Welcome, everyone. Before I welcome our guest speakers, I just want to take a minute to acknowledge the history of the peer-to-peer knowledge exchange, and that this is a monthly cross-sectoral collaboration and skill sharing hub. It's coordinated by StepStones for Youth and OECAS. And attendees are stakeholders from across sectors with a shared commitment to supporting the well-being of children and youth. P2PK was the vision of our founder Shua Roskies at the time of the Office of the Children's Lawyer in response to the gaps in services experienced during COVID-19 pandemic. The vision was to create a space where child welfare practitioners, child and family service organizations, and youth and infirm care could come together to share best practice and amplify some innovative programs and strategies to support children and youth, one of which is here with us today. Today, we are joined by Marib Hasib and Michelle DeFebo to share about the Family Navigation Project. The FNP project is based out of Sunnybrook. It is a free virtual service helping youth ages 11 to 29 and their family of choice across the GTA. They find and access mental health and addiction supports. This is co-created by families with lived experience, and their culturally trained or clinically trained navigators work with each family to build a personalized plan, connecting them to the right services for their needs. Since 2013, FNP has served over 6,000 clients, and a recent expansion has allowed them to extend support to equity deserving communities with a new site in the Sudbury, Manitoulin region. Just a reminder that the presentation is being recorded and that we will follow up with an email with a link to the recording and some resources, including the slide deck from today's presentation. As always, there'll be time for questions at the end, and we will wrap up by 2 p.m. We'll keep an eye on the chat throughout, so feel free to drop any questions or requests for support there as well. And with that, welcome to our guests.
Hi, good afternoon. Thank you so much for introducing us. My name is Marib. I use she, her pronouns, and I'm the Community Engagement Coordinator at the Family Navigation Project. And I'm joined by my colleague, Michelle, who's also a Family Navigator on our team. And thank you again for having us today to share more about FNP and how we might be able to support you and some of the youth and families in your community. I'll pass it off to Michelle to get us started.
Yeah, hello everyone. Thanks for having us. What I'll do for this slide, we just wanted to give you a bit of history about us, and Sonia touched on a bunch of these points. So I will just flag a couple things that I think are important to know. Family Navigation Project really had a grassroots start. So created by a group of caregivers in the Toronto area who really were working hard to find the right supports for their young loved ones, and really couldn't do it the way that they hoped to do it. So they found the system very confusing, or maybe the supports just weren't there. They were able to connect with a psychiatrist who's still our medical director, Dr. Levitt at Sunnybrook, and they co-created this program to help other families so that they wouldn't feel as lost as they had in the mental health system. We do support, we are connected with Sunnybrook, and sometimes it's confusing for people with our name, but we really are wanting everyone to know that although we're connected with the hospital, we work more like a community program. So we support families across the GTA, including Durham, Halton, Peel, York, and then Toronto. Youth need to be within the ages of 11 to 29, and one family member or family of choice person needs to be living within that area. Those are really our two eligibility requirements. We don't have a time limit, so we work with families and youth as long as navigation is helpful. So for some people, once we've found a support, they feel connected, I would step back. For others, things might be a little more complicated. Maybe they're accessing supports across different systems, or there's a wait time that we need to help support during. It can take a little longer. And then we are always available, although we kind of technically discharge on our end. The file is really always available for our clients to come back and reconnect. So hopefully they can connect right back to their family navigator they worked with, and they just pick up where they're at and reactivate their case. And we do see that, as we know, mental health is not have a doesn't always have a start and a stop. It's not linear. So we might work with someone when they are transitioning from middle school to high school. We might really work closely with family. And then when they're going high school to university, maybe the youth calls back and has support just on their own. And then throughout all of the time that navigation's been open, available and open at FMP, we are 100% funded through philanthropy. The RBC Race for the Kids is our biggest funder, and we're available free of charge to families. No OHIP card is necessary. And we are able to look at public or private resources depending on what's the best fit for the family.
So these are some aspects that I think make us pretty unique as a program. So the first is that we have pretty extensive system knowledge. So like Michelle had just mentioned, we can navigate to public and private resources depending on what is of most use and what is most accessible to the youth and families that we work with. We keep our resource database up to date. We have over 950, I think, at this point, resources, and we try to maintain it through active connections with service providers. So about 20% of our navigators' role is to make sure that when they're offering suggestions or options to youth and families, that they will meet the match or meet the goals and the needs of the youth and the family, that the programs are active, and that they meet all of the eligibility of our clients. We also have an interdisciplinary team. So we have consulting psychiatrists who don't meet with clients directly, but mainly provide like a biomedical lens in the background. We have peer support staff or staff with lived experience. So we have a parent and a youth advocate with lived experience. And then we have our navigation team, which typically come from social service or clinical backgrounds. So we have some folks who come from social work. We have some child life specialists. We have some addictions mental health specialists. And so this team really works together to find the best resources and supports for every youth and family that we see at FNP. We can also work with interpretation services and translators if clients prefer to access navigation in a language other than English or whatever they're most comfortable with. We also try to be as low barrier as possible, so there's no diagnosis or referral that's needed for the program. So as long as there's some sort of mental health or addictions concern, even if the youth isn't necessarily to reach out or be connected to supports or services themselves, a loved one or a family of choice can reach out on their behalf. And that family of choice is really anybody who's important to the youth. So it could be somebody they're related to, like a parent or sibling. It could be a friend. It could even be a service provider, a mentor. And that loved one can reach out for support, and we would get the loved one connected with support, along with thinking about ways how we might be able to get that youth ready to access supports or resources. We are also a program that focuses on delivering goal-focused support. And so our goal is really to match youth with the right services that they need. So we're similar to case management, but for example, we wouldn't necessarily accompany youth to an appointment. It's mainly about matching them to the right services that they need and then taking a step back once they feel like that they are well connected and well supported. But again, they're always welcome to reconnect with us up until the age of 29 if new services are needed. We also find that this model really works best for folks who might be facing a lot of complex barriers in accessing the mental health and addiction system. So I have some examples listed on this slide. And so sometimes this can look like folks who might be on multiple wait lists for services. A lot of the times, the youth that you'll be working with naturally in the child welfare system will be facing multiple of these complex barriers. So whether they've had involvement in child welfare, justice, the legal system, maybe there's complex family dynamics. Maybe the youth is not ready to engage in services, but they still really need some resources or support, or the family is looking for some resources or support. We also take a holistic approach to navigation. So if there are other needs in addition to the mental health and addictions, like employment or housing, or settlement needs if they're a newcomer, we can navigate to those resources and services as well, in addition to focusing on the mental health and addictions, just acknowledging that all of these challenges are very interconnected and you can't really address one without addressing the other.
All right. So really our goal when we're providing options is to do more than just giving a family a list of phone numbers and websites that they kind of have to wade through on their own. So we wanted to just quickly take you through our process to give you an idea of how we work. Just a shout out to our Youth Advisory Council. They're the ones who created this model to help explain what we do. Um, the first thing that needs to happen is that the family or youth reach out. So there's no referral required. This is a phone call or an email to our intake coordinator. They I think important to mention that we don't have and never have had a wait list. So the connection from intake coordinator probably will happen within 2 days max. They'll do a brief screening, just make sure that they kind of check off those pieces of eligibility. So living within the GTA with a mental health or substance use concern. Um, and looking for support. I think also important to note that we really don't ever turn anyone away. So if someone is outside of our age eligibility or outside of catchment, they're always going to get something. So although they may not be connected with a navigator, we will still go through the process of meeting with our team and coming up with some options to get them started in the right direction. After intake, they'll be connected with a family navigator. That person will be their connection for their time at FMP, and they're the person that helps to find the services and options and get them connected. The first phone call that we have is we call a needs assessment. So really, we don't do any standardized um, model of collecting the information, but an opportunity for the family to share in their words what's been going on for them and what they're hoping for. The navigator will bring that information to our team review, which will include other navigators, the psychiatrists that Marv mentioned, and our two staff with lived experience. Together, we come up with ideas for next steps and a pathway, and we start to think about what options and resources could be a good fit. It's then the navigator's job to do all the legwork for the family on resources. So reaching out directly to clinicians or programs, places, finding out things like wait time, referral process, what it might feel like to connect there, what the expertise is there, and bringing those options back to the family so that they can decide. We try, if it makes sense, to give at least a couple of options so families can have some autonomy on what they choose when that's possible. And then, like we've mentioned, we stay connected as long as it's helpful. So for some, it might be a little a more of a warm handover, helping to transition to the support. For others, once they have the information and have some preparation of how to reach out, they feel confident doing that on their own. And then we stay connected as long as it's helpful. So for some, a few check-ins to make sure that a fit is right. And for others, it might be connecting with one while you're still working on doing some additional connections.
So these are some examples of resources that we might be able to connect folks with. Again, like Michelle just said, they're really offered as suggestions based off of the goals and the needs of the youth and the family. And so we're really aiming to take a collaborative approach and allowing them to choose what works best for them. And so sometimes that can look like connecting them with counseling or therapy supports, but that might not always be the right fit or what they're really looking for. Sometimes a community, social, a peer group might be a better fit. Really adapting our approach based off of what they're looking for. And so there's just a couple of examples listed on the slide here. So yes, in addition to the counseling and therapy supports, any helplines, any interim supports while they might be on wait lists, sometimes that can look like online resources, other social employment, housing, health, and settlement services, finding resources specific to their identities, if that's something that it's important to them, we can get them connected with those as well.
And we wanted to just take you through a couple of case studies. So we've kind of um, taken names and identifying features together and put a few stories together just to give you an idea of some of the complexity that we see and what we have been able to do with families. So an example of an intake might be a parent calling on behalf of their youth. Um, the youth just being hospitalized for mood, anxiety, and depression. And they're left with recommendations from the inpatient team that flag that a developmental assessment would be helpful in addition to the support for mental health. We know that the youth is using cannabis as a coping strategy and that the family is a newcomer family with high needs around finances and financial strain. The family also has never, this is their first time accessing mental health in Toronto. And both parents, one parent speaks English and the other one doesn't. So they're going to need some support around translation services. Once we were able to speak to the family, the plan that the Navigator came up with the family was to look for options for an ASD assessment. What we know with this type of assessment is that wait times for OHIP covered assessments are very long, can be over a year, and there's financial barriers to getting a private assessment. They can be quite pricey. We exhausted all of the options that we could looking through the OHIP system. We have built relationships with private clinics that we were able to access, and we were able to find a pro bono assessment for this family. The Navigator was also able throughout the process to provide psychoeducation around how to access the mental health system, questions that you can ask, the rights that you have within the system, when parents can be involved, and some information around consent. There also needed to be some learning and questions asked about a new diagnosis that was provided of ASD. And we were able also to look into some harm reduction support. Youth was interested in learning what that means for their substance use. And in the end, and I would say this type of client story would be one that takes the kind of high end of the length within navigation, just because you're also working with wait lists and the time it takes to get these things done. So it may take a few months or more to do something like this. Navigator was helped to connect the family and youth to developmental services and OSAP for some additional funding for the family. They were connected to a substance awareness program that was offered free of charge. Um, once some of the funding was approved through the passport program, we were able to connect with some in-home and different community supports that had a cost associated. And they were also able to provide ongoing caregiver support that eventually was able to also include siblings for things that with programming that's available in the community.
Another example of a story we have is a youth calling FNP directly. And so this was a racialized youth who was identifying as queer that was looking to get some additional supports. they were living in a household where mental health was stigmatized and not really talked about. And so they were really struggling with being able to find the right resources and support. They were facing a lot of school stress, some low mood, which was impacting their motivation to attend school, and even decided to take a gap year to really focus on themselves. In the past, they had tried to find help, so they tried speaking to a counselor at the school, but the approach wasn't really the right fit. They had started psychiatric medication before calling FNP, but they'd actually been feeling worse since they had started the medication. And so their goal that they had identified was to connect with a therapist and develop some new coping strategies. And so after they connected with the navigator brought this back to our team. And during that team review process, one of the consulting psychiatrists suggested to immediately follow up with their prescribing doctor. And then the navigator was able to help support the youth in creating a list of some negative medication side effects that they were experiencing. And so that's just one way that a navigator might be able to take on a little bit more of an advocacy role and make sure that the youth feels ready and equipped to speak to another provider that they might be working with. Um, the youth also connected with our youth advocate village experience for peer support, and that connection really helped them understand that they're not the only person who's experienced something like this. And also, our youth advocate village experience can also share their own experiences and trying out different services and what they can expect. And so they found that tool to be extremely helpful. And then the navigator also found some low cost options or no fee therapy. So one was for Free Counseling Society Canada, other was for a youth wellness hub, specifically finding counselors that were culturally competent and affirmed their 2S LGBTQ plus identity. And so after this navigation plan, the youth was able to meet with their doctor, share the symptoms that they were experiencing, and their medication was altered, and their mood, as a result, stabilized and improved. The youth was also able to connect with an online peer group, and again, really appreciated that connection with our youth advocates' experiences in using different peer resources and peer groups. And then they also connected with a youth wellness hub for ongoing counseling. And then once their mood started to improve, they ended up applying for post-secondary school. So just a great example of how it might look for a youth going through FNP over a few months period. We also have some testimonials on the screen, which kind of help demonstrate the impact of our program. I'm not going to read them, but I'll leave them on the screen for about a minute so that you folks can have a time to just read them. One is from a youth and another is from a caregiver we've supported.
All right, so as we've been sharing, you might have started to think of youth or family in mind that this kind of type of program might be helpful with. We also wanted to just give you some other things to think about. So if you're working with or know someone in your life with a youth who's 11 to 29, or a family member who is connected with a youth, some things to think about where FMP might be helpful. Maybe there's something that someone's just unsure about within how somebody's acting or their mental health, and they just don't know how to get started with help. So someone who's maybe just starting their mental health or addictions journey, we can be helpful for that. Maybe someone has tried a few supports, but has like stalled, or maybe it just wasn't working and they don't know where to go next. If someone has tried multiple services, or maybe they're already involved in a service, but it's just not working, we might be able to be helpful there. Again, just to note, I think Marab mentioned at the beginning, but we really do see a lot of caregivers and loved ones calling for their youth. And we are able to support a parent or caregiver, even if the youth is not able to or ready to access services. So we'll start with the person we're talking to and meet them where they're at, look for parent or caregiver supports, maybe give some suggestions of how they can get support for themselves and also move things forward if changes need to be made. And then, as we all know, wait lists are lengthy across all systems. And we can also be helpful if someone's already on the wait list. What we found from the beginning of when our program started was sometimes because these wait lists are so long, someone will think that all of the right things have been done. They sit on a wait list for months and months and months, and then when they get to the top of the list, they find out that this wasn't the right list to be on. Or maybe they've aged out, or something has happened, or they really still, the temperature is really high in the house and we have to wait on the wait list. So, for all of those things, a navigator can be helpful, checking status on referrals, making sure something's in the right pile, looking for things that might be able to be helpful while somebody's waiting for the kind of gold standard that they're hoping for.
And so these are some next steps listed on the slide. So while all of our programs entry is through self-referral, so through phone or email, typically a few ways that you can share the program with us would be for youth and families to reach out to us directly, such as sharing our contact information so that they can reach out. Sometimes that's not the most accessible for folks, so we can also do what we call a warm handoff. So you're welcome to introduce the youth or the family to us with their consent. If you or some of the staff that you're working with have the capacity to, they're welcome to complete the intake together, or work with the navigator, really just depending on what the comfortability is for the youth or family member that they might be working with, just to support some of that trust building. And since we're at the peer-to-peer knowledge exchange, we also have a peer-to-peer consultation level at the program. So sometimes you might be working with a youth or a family that isn't ready to reach out, or sometimes a navigator might not even fully make sense for their situation. And so if you might just be looking for some resources, you can still reach out to our main intake line. The contact information is on the slide, and it'll also be on the last slide as well. But if you reach out to the intake line, share a little bit about what's going on, but you don't have to share any identifying information. They can give you some resources that you can then share with the youth or the family directly. Um, we're also very much currently expanding our outreach and engagement efforts across the GTA. So if you find that this program is a helpful resource for you, and you want to share it more with other colleagues you might be working with or other programs you may be connected with, you're welcome to reach out to me. My email, my phone number is on the slide there. And we're happy to deliver a similar presentation, even if it's 10 to 15 minutes, talking more about the program. And really finding that the peer-to-peer consultation pathway has been pretty popular or well utilized among service providers. We also do weekly meetings with service providers and what we call meet and greets. And so those happen about once a week. And if you're interested in meeting with our frontline team, so the other navigators, our staff with lived experience, again, you can send me an email. We can set up a time for you to meet either virtually or in person with our team and share more about your services and programs so that our resource database is up to date when we're making referrals. And lastly, we're always very happy to participate at any community outreach events, whether that's hosting a booth, delivering a workshop or a presentation, engaging with youth and families directly. Even though we're a virtual program, all of our outreach can be in person, which is great. So any opportunities to get out in the community, we're always very happy to participate. And so that's all from us. Thank you so much for listening. As always, you're welcome to reach out to our intake line, which is family navigation at sunnybrook.ca, or the 1-800 number. And we're also happy to take any questions now. See a question in the chat. So we have no wait list for the program. Within a day or two of reaching out, we work during business hours because we're not a crisis service. So within a day or two of reaching out, our intake coordinator gets back to the person who reached out.
And then there's no wait list to get connected with a navigator either. So
Yeah.
everyone's probably connected with their navigator, depending on how the family schedule is for connecting within another couple of days after the intake, they'll be connected with their navigator. Was there another question?
Yes. So the other question was, I'm assuming families and or children in care of Children's Aid Society can reach out for help. Yes, they are very welcome to reach out.
And when a children's service worker or family service worker is involved, then we just try to collaborate directly with them as well so that we know what's already been offered and aren't duplicating anything that's already been done.
Any other questions? Um, this is a program that folks have heard about before. I know we've been around since 2013, but I think a lot of people, even if they've seen FNP or the RBC Race for the Kids, the Sunnybrook attachment can get kind of confusing, but we really are a GTA-wide program. Um,
We can also we would be following the same consent and privacy as other professionals across everything. But if somebody wants to have, what we try to do is have a navigator work with the family members and youth when it makes sense. But if there are cases that are complicated and need two different people working with them, then we can be flexible as well, if that's something that either the youth or the caregivers are wondering about.
Thank you.
There are any last minute questions? Ask those.
I can just reiterate a couple of other pieces that might be important for some families is, again, there's no documentation needed, so no health card, no IFHP if they're a refugee family or youth. There's also uh, interpretation services available as well, again, if folks can access navigation in language they prefer, and all of it is provided free of charge through the hospital.
It was also originally created with a focus on transitional age youth, so kind of 16, 17 to 19. So those kids that where services kind of drop off, or you're transitioning from children's services to adult services. We have found as our age range has expanded over the years that obviously there's transitions at lots of different stages of life. But definitely we have a lot of experience supporting youth that are transitioning from children's services to adult services that may be who are in care that might be leaving children's services going into adults. And then recently we have in the last couple of years expanded to cover young adults up to age of 29 as well.
All right, that's so great. Want to give a huge thank you to our presenters, Marie and Michelle, as well as Sonia, for joining us from OCAS. We're going to be following up tomorrow with an overview of the presentation, as well as a link to the recording, which will also be on our YouTube channel soon, and some online resources as well from the FNP, or the Family Navigation Project. So thank you all so much for coming, and we hope to see you at the next P2PKE.